Welcome to Community Medicine Insight. In today's video, we will talk about an important concept, that is Iceberg Phenomenon of Disease. Iceberg phenomena describes a situation where only a small proportion of the disease is visible to the health system, while a larger proportion remains hidden in the community. In iceberg, only a small proportion is visible outside, while a larger proportion remains hidden. Similarly, in the iceberg phenomena of disease, the visible tip represents the diagnosed cases, while the submerged portion remains the major chunk of the disease, which is undiagnosed or subclinical cases or the unreported cases. So in structure of iceberg, it constitutes two parts, the tip of the iceberg, that is the visible part, and the submerged part, that is the invisible part. These are the cases which are visible to us. So a clinician sees the tip of an iceberg, while the submerged portion constitute your subclinical cases, the cases which are not diagnosed, asymptomatic cases, carrier, latent cases. So an epidemiologist is more concerned with the hidden part of the iceberg. What is the difference between a subclinical case, a latent case, and a carrier? In subclinical case, although the infection occurs in a person, but there are no noticeable sign and symptom, but the pathological changes or immune responses are present. Either the patient does not show any sign and symptom or they are very mild. Subclinical cases can only be detected by the lab test or the serology, and they are usually not infectious but may be infectious in some of the disease. So it indicates the hidden disease burden. What happens in latent case? Although the infection is present but the disease is inactive and symptom may appear later on. So at that time the symptoms are absent and the disease is detected only by some specific test. During the period of latency, these type of patients are not infectious and there is always a risk of deactivation in such cases. Carrier is a person who harbor and sheds the pathogen without showing any sign or symptom, and the carrier can be detected by either culture or molecular test, and they are usually infectious. And the important point is they are very important source of disease transmission. Why does the hidden part exist? There may be multiple reasons for this. There is lack of awareness. The patient is not aware about the disease. The patient is not having any symptom or symptoms are very mild, so patient doesn't seek any sort of health care. Other reason may be poor access to health services. The patient may be hiding signs and symptoms due to some social stigma and not seeking any health care services. Maybe the person is taking self-medication. Other reason may include inadequate screening programs in the community. Iceberg phenomena may be seen in infectious disease and in chronic disease. There are many examples, like in tuberculosis, many latent TB cases occur. In COVID-19 pandemic, we have seen that many cases were asymptomatic or mildly symptomatic cases were occurring. There is a long asymptomatic period in the cases of hepatitis B and C, and similarly in the case of HIV, there is a long asymptomatic phase. Into non-communicable disease, like in case of diabetes, hypertension, many undiagnosed cases occur because of lack of various sign and symptom. Mental health disorders, anemia in the women. In these cases, most of the individuals are unaware of their condition. What is the public health importance? It indicates that the hospital data may not represent the true disease burden, and the planning based only on the reported cases may be misleading. So the community based surveys are essential for the planning of health services, And preventive and promotive care is also important. What are the implications for disease control? There is a need for screening program. There should be surveillance systems. They must be focused on the early detection of disease and strengthening of primary health care.